Hello, I'm Dr. Mark Koenig from Medical Age Management in San Diego, California, and today I wanted to spend a few minutes talking to you about bioidentical hormone replacement therapy. Now, this is a pretty complex subject that people spend hours lecturing on, but for today's purposes, I just wanted to give you a very brief overview. So I hope you enjoyed the video, and please remember to hit like and subscribe to my channel for future videos. First of all, hormones are integral to aging. There is some debate about whether our hormones are falling because we're getting older, or if we're getting older because our hormones are falling. It's really a chicken and egg phenomenon, but the important thing to remember is that decreasing hormones are a major factor in aging. Women who are in perimenopause and menopause are suffering from decreased progesterone as well as failure of their ovaries to produce estrogen, and both men and women are suffering from diminished testosterone. Yes, it's true, women need testosterone too. Either gender of any age could be suffering from suboptimal thyroid for many different reasons, and there are other hormones such as DHEA, growth hormone, and melatonin that are important to evaluate and support. The decline of hormones from a youthful level has not only been associated with decreased muscle mass, increased body fat, and lower energy and libido levels, but has also been shown to be associated with increased risk of cardiovascular disease that can lead to heart attacks and strokes, as well as cognitive decline and some types of cancer. Decreased hormones has also been shown to contribute to osteoporosis, thin and sagging skin, and even anxiety and depression. So restoring your hormones with bioidentical hormones is really an important aspect of minimizing your risk for developing these processes. And when you combine it with a lifestyle of good food choices and exercise, it's really the closest thing you're going to find to the fountain of youth that so many people are looking for. Unfortunately, hormone replacement therapy has received a bad rap, and that is primarily based on concerns for cancer and adverse health effects. A lot of the misinformation came out of the Women's Health Initiative study, but the important things to remember are that the estrogen used was derived from pregnant mare's urine, and it's been found to contain at least 10 estrogens that are foreign to the human body. The progestin was synthetically derived, and it's not identical to what your body naturally produces. To date, there have been no studies showing any association between cancer and bioidentical hormone replacement therapy. You can use hormones that are identical to what your body produces with the goal of restoring and balancing them to more youthful levels. Dr. Neil Rouzier says you should be afraid of losing your hormones, not replacing them. So if you decide to pursue bioidentical hormone replacement therapy, your physician will be able to track your levels and, when combined with your clinical response, determine your optimal route and dose. It's important to remember that hormone level ranges are based on population averages and are age adjusted. And if you look around at our general population today, people really aren't that healthy, and they're becoming less so with the increasing prevalence of diabetes and obesity. So just because your levels may fall within normal ranges does not mean you're healthy, and it definitely leaves room for optimization to improve your function and your vitality. Bioidentical hormone replacement therapy is a pretty involved process, and you really should see a provider who's appropriately trained in this modality. It is a bit labor intensive in the beginning, with frequent office visits and extensive testing to evaluate your metabolic profile. Be prepared to spend an hour with your provider, which is really different than a 15-minute office visit with your PCP. The good news is that once you're on a regimen to optimize your hormones, routine follow-up visits usually occur twice yearly and are an opportunity to help you maintain and fine-tune your program. In addition to balancing your hormones, a functional medicine provider will also be able to address issues such as proper nutrition and weight management, improving your sleep, managing your stress, and supporting your body's detoxification. Bioidentical hormone replacement therapy is just one very important component of a preventative health regimen. If you really want to live a longer and more active life, there are many tools you can use to achieve your goals, and bioidentical hormone replacement therapy is a great place to start. So I hope you've enjoyed this video and learned something new. Please remember to hit like and subscribe, and most importantly, have a great day.